Hi guys, Scott McConnell here for Distance CME, and hey, we've talked about CPR, we've talked about ACLS. Now, of course, let's get into PALS, where there's a couple of specific changes. So, once again, just some bullet points here about the new 2015 American Heart Association guidelines. Once again, I highly encourage you, go to the American Heart Association website, read the science behind these changes. That way it gives you a better understanding. But let's talk a little bit about some bullet points about PALS 2015. If the patient is in a limited resource center, you're going to definitely want to watch administration of isotonic fluids in septic shock patients. Now, they're not saying that a full-blown level 1 trauma center, pediatric, NICU, the whole 9 yards, those patients, of course, we can monitor a little bit better than your local community hospital. So that's really what they're talking about. Of course, septic shock is septic shock, so you definitely got to be careful with that. They're still recommending the 20 cc's per kilo bolus infusion of isotonic solutions. There's been a lot of back and forth since, boy, I'll tell you, I've been in EMS since 1990, and there's always been back and forth about pre-treating infants with atropine to prevent bradycardia with intubation. But now the American Heart Association comes out and says atropine with pre-medication for intubation is not recommended unless you suspect you're gonna get bradycardia with intubation. Right, so pretty interesting there. Finally out the window. Treating fevers, absolutely. After return of spontaneous circulation, fluids and vasopressors to maintain a blood pressure in the 5th percentile for age, and put in an A line to monitor pressures. Right, so some pretty interesting stuff there. And I'll tell you, all through my paramedic career, I've been taught this part over and over again. So a little bit of a change. Term and preterm who do not require resuscitation delay cord clamping by 30 seconds. Okay, makes sense. Get a little bit more from mom. Now here's some of the interesting parts. If an infant born through meconium-stained amniotic fluid presents with poor muscle tone, inadequate breathing efforts, or not breathing, the initial steps of resuscitation should be completed under a radiant warmer. Positive pressure ventilation should be initiated if the infant's not breathing or the heart rate is less than 100 after the initial steps are completed. But now, routine intubation for tracheal suctioning in this setting is not suggested. There is insufficient evidence to continue recommending this practice. However, a team that includes somebody skilled in intubation of the newborn should still be present in the delivery room. So all those meconium aspirators that we have in our pediatric bags, I'm reading this as you're never ever going to use them. So just some bullet points from the new PALS 2015, guys. Highly, once again, recommend go to the American Heart Association website, read the science behind it. It's free, doesn't cost you anything. At least it gives you a background of why things are changing and a look at the studies. So guys, once again, Scott McConnell here for Distance CME. Take the classroom with you. Stop sitting in a classroom, wasting time, wasting money. Come and research with us. Take it easy and be safe out there, guys.